You know, there may come a time when you have some foot or ankle problems that could call upon you getting some surgery. Well, you want to be sure that you get the best surgery that is available with the newest technology. Well, today we're talking to Dr. Mullins with the Bienville Orthopaedic Center here on the Gulf Coast. And Dr. Mullins, good to see you again. It's been a while.
Thanks for having me.
Well, thank you. We're going to talk about TenJet in just a minute, but give us a little bit of background about yourself, if you would.
Yeah, so I'm an orthopedic surgeon, but I did a foot and ankle fellowship in Vail, Colorado, and been in practice.
Oh, that's terrible.
It's a tough life. It's a tough life. But I've been here with Bienville 2 years, and obviously I specialize in foot and ankle, all different types of problems, from hammer toes to heel pain, all the way up to big reconstructions of the foot and ankle, and that's kind of my specialty right now.
Well, I'm sure up in Vail you saw a lot of skiing issues up there, but not so much down here.
Not so much here. Well, I see a lot of heel pain down here, and that's going to be a little bit of what we kind of talk about today, too. So.
What is TenJet?
Yeah, so TenJet is a fancy kind of procedure that we have to help people with tendonitis and what I call tendinopathy, or people that develop some scar tissue problems and wear tendons inserted into bones. And so most commonly in the foot and ankle, I see that in the Achilles tendon that comes down the back side of the heel, as well as on the bottom side of the heel. But many of my other specialists in my group treat it with elbows, shoulders, even in the knee sometimes too as well. So TenJet is a needle type procedure that we use to put into the tendon, and what it is, it's kind of like a pressure washer. So imagine with me that you're pressure washing your house. Well, you're taking off the bad stuff and you're leaving the good stuff.
Right.
And so in the same way, this uses a type of using water to debride a tendon at a very high pressure, and there's a small 1 millimeter window in this that takes and sucks the bad tissue out. And I do this under ultrasound guidance by looking at the tendon, and I can tell exactly what I've taken out. And so it's a very small, minimally invasive, making a small poke hole.
It looks like it. There's not a whole lot to that.
Yes, this is a very small needle, and like I said, a 1 millimeter window that just requires a small incision that even under a local anesthetic you can use to do this procedure for sure.
So this is considered surgery?
I would say it's considered surgery because I like to do it in a more controlled setting. This isn't something that's usually done in the office. I like people to be comfortable. I like them not to have much pain associated with it. So I put a lot of local anesthetic, and sometimes I use this in conjunction with other procedures I might be doing around the ankle as well.
Well, I was going to ask you if it was painful.
I'd be lying if I said it was non-painful, a piece of cake, but at the same time, in the grand scheme of surgeries, it's a very quick recovery in regards to these type of things.
So as a foot and ankle specialist, what are some of the conditions that you treat that people deal with? So
the most common one is heel pain and plantar fasciitis. So a lot of people have pain first thing in the morning when they get up. They take those first steps, or they've been sitting down for long periods of time. They get moving. They feel that heel pain. And that pain can ache as the day goes on and people are up on their feet. So this is a good option for people who have failed conservative treatment. So people that have taken medicine, they've done the stretches I've recommended for them. Obviously, this isn't a first-line treatment. I like to treat people in a conservative fashion as long as possible.
I know I'm probably asked this question, but can you use it to treat neuropathy?
This isn't really a neuropathy type of treatment. Sometimes when nerves are getting pinched around the ankle and foot, I like to go in there and look at the nerves themselves. This isn't really meant to treat this. This is more of a tendon type problem than having to do with nerves themselves.
So pulled tendons, things like that. You know, I'm sure with a lot of athletes in the area, you know, football season, things like that, you're going to have those issues.
People getting back running now, getting back to the gym, trying to exercise more, they're starting to feel that heel pain again, and so that's when it kind of leads them to talk to me about some of the options, and this is a great one for people.
Does it leave a scar?
Very tiny one that goes into the fold of the skin that is hardly noticeable to people. So,
and I'm sure nobody's going to ask you to pull your shoe off. Let me check your foot.
Exactly. Yeah, scars on the foot hide very well with shoes.
What's the recovery time like?
So I tell people it's usually a full 3 to 4 months before you're looking at full recovery. But when I do this procedure, I let people walk on it right away, usually in a boot, and I let them walk even out of surgery. So usually it's some physical therapy to help getting it going again, and they can get back on their feet very quickly.
Now that's, as you said, with a number of people that are getting back and working out and doing things like that, that's going to be important to them.
Very. And so they want to get back to doing the things that are important to them, back losing weight, and that's important as people maintain their health for sure.
Now, what kind of symptoms can someone that they may have that might consider that this is something that they need you for?
Yeah, so I tell people pain that's around the heel that just isn't going away. It's okay to have pain after you exercise as long as it goes down, but if it's sticking around and people are feeling that, then it's definitely good to get checked out because there's specific stretching, medications, different type of exercises that will get people back faster. And then like I said, if they need a surgical intervention down the line, we're there to do that too.
Now, what about rehab afterwards?
Yeah, so rehab is usually 1 or 2 times a week, just trying to get the area stretched out and not allow it to scar back down, and that's a big part of it, as well as helping their pain and swelling and get them back moving again, for sure.
Does insurance cover this?
Yeah, so insurance, it all just depends on your specific kind of insurance. We have people here that obviously look and make sure that this is something that's covered, but this is covered by most insurances without a problem.
Now, would I need to get a referral from my general practitioner to come and see you regarding this?
I tell people it's always good to check with your insurances and the peculiarities of everyone, and so you know, we take referrals, and I'm open to see people for this problem at any point, and so just always check with your GP, but most of the time we don't need a referral to see you for most commercial insurances.
What's the longevity of about how long it's it will work?
Yes, yes.
I guess that depends on the person.
It depends on the person, how long their symptoms have been going on, and what kind of treatments and surgeries they've had beforehand. But for most people, I say this is a good option for them.
Okay. And anything else that you want to add regarding this special surgery? I mean, it's really amazing that you can go in and just, with that little thing, then,
yes, and
as you say, pressure wash it and suck it out at the same time.
Pressure wash and get the stuff out, and I think it's a great minimally invasive option for people who want to get back moving faster, who don't want a big incision that they have to wait to heal up faster, and gives them a good chance to get back to their activities.
I guess they could go online to your website, Bienville Orthopaedic's website, get some more information about it, or even go online and Google or TenJet.
Yep, Google TenJet and Hydrocision and look at our website for more information about it for sure.
All right. Appreciate your time, Dr. Mullins.
Thank you, Jim.
Now, if you're having some issues, again, with your feet, or as Dr. Mullins said, you know, elbows, knees, or whatever, and maybe you're thinking that this is something that'd be good for you, you can go online, find out more about it, set up an appointment, as Dr. Mullins said, perhaps go to your general practitioner and get a referral first. But TenJet, great, easy, minimally invasive way of getting that relief that you might have in your feet, your ankles, or whatever, from Bienville Orthopedic Center here on the coast.